They're called laugh lines, but you don't feel like laughing when you see them around your mouth. These lines are a natural part of aging. They appear because the ligaments around the mouth and chin loosen, allowing the tissue in the cheeks to sag, creating fine lines. Some people are genetically destined to have these lines, and they're exacerbated by anything that accelerates the loss of collagen and elastin in the skin, such as smoking and sun exposure. If the thought of laugh lines make you want to frown, then the good news is that they can be prevented as early as your 30s with injectable dermal fillers.
For the loss of volume that people get just with intrinsic aging, we inject fillers such as Juvederm or Restylane or some of the brands that were used. Those are injected usually into the lower part of the face. They can replenish the volume that gets lost with age and to help give us smoother lines.
Injectable dermal fillers do exactly what their name implies. They fill. These fillers contain products such as collagen, calcium hydroxylapatite, and hyaluronic acid to plump up the skin. What kind of filler you use depends on your goals.
Fillers tend to last a lot longer, and there are different types of fillers. Fillers can be either temporary, semi-permanent, or permanent. We don't really use too many permanent fillers because they have a lot of risks and side effects, but we use some fillers that are hyaluronic acid. They include Juvederm and Restylane, for example. Hyaluronic acid is a natural component of our skin, so we're really just replacing the hyaluronic acid. They last about 1 to 2 years when they're injected.
Hyaluronic acid fillers are the most popular type of filler. They're usually injected directly into the wrinkle you want to erase. Dermal fillers can also be used to add volume to the cheeks, jawline, and temples to give the skin a lift.
People always look at this fold around their lip, but really what they're seeing is a droopiness. And if you could lift a little bit from the cheekbone and give people a better shape of their face, that gives them a more youthful look. If you look at a young person's face, they tend to have an inverted triangle where it's broader across the top of their face and it comes more to a point at the bottom. If you look at an older person's face, it becomes more of a square or a regular triangle because it becomes everything droops. You're broader at the jawline and more narrow at the top. You get sometimes some loss of volume in the temples. And so by filling up here, again, you direct the shape of the face and it gives a more youthful appearance.
Then there are collagen wrinkle fillers. These fillers replace some of the collagen that is naturally lost in the aging process. Some research shows that repeated collagen injections help stimulate the body's natural production of collagen, which will reduce the appearance of wrinkles in the future. Many people think that this is a more natural-looking option.
There's another filler we call Sculptra. Sculptra is used more all throughout the skin, and your body makes collagen around it. So instead of with the other products, what you see is what you get. You put in a cc, you get in a cc. But with this, you put in a certain amount of the filler, and then your body develops collagen around that filler. And so that's very good for people who are very gaunt and who are very thin-faced and really need more volume as they get older.
You should always receive wrinkle fillers in a medical environment with sterile instruments. Your dermatologist will only use FDA-approved wrinkle fillers, and let's be honest, if you're injecting anything into your body, you want it to be legit. Most injections take less than 30 minutes to administer.
Most of the times with filler, we do put topical numbing on prior, and there's also lidocaine mixed in with the filler. So as you have the injections, your skin gets more numb. So after the first couple, you don't really feel it.
You should protect your skin from an early age to reduce the likelihood of wrinkles. Use sunscreen daily. As a bonus, you'll also protect yourself from skin cancer. And that's definitely a reason to smile. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.